Thank you very much. Hi, everyone. Let's get going. I'm just going to give you a bit of an update provincially. Today, we were 916 cases up, which is the first time we're less than 1,000 in a long time. Again, driven by Toronto area, but numbers are lower across the province. Ontario, Ottawa had 50. We actually had a very good weekend compared to previous times. Essentially, we just want to, okay. We actually, for today, so far we have no cases. And over the weekend, we added, I think, 3 on one day and 4 the other day, just to show you. In total, we added 7 cases, minimal across, which is very good news for us. And if we're looking at our rolling average, again, we're actually hovering in the yellow range right now, using the old rolling average framework. And so I think that is very good news for us. We're sort of stabilizing here, and that's over a week now from the Victoria Day weekend. So hopefully we haven't had a bump related to that. And so again, we're just hopefully going to continue this trend of going downwards, which is very good news for us. Again, waiting on a few things. Waiting on the government to tell us what's going to happen on June 2nd, waiting as well as proximate dates of step 1. I know that they've extended the interprovincial travel ban till the 16th, and I think outside campgrounds as well close until 16th, but everything else we're not sure what's going to happen. But again, the numbers are going in the right direction, both locally and now provincially, although again, when I looked at the ICU numbers, we're over 600 again provincially still. So it's still taking a long time to go down, although the hospital admissions are down to 731, and at one point they were almost at the 1,900, 2,000 range. So at least we're seeing a downward trend. We're continuing to see, again, no outbreaks in our area. We still have some hospitalized patients, but nothing, it's not increasing. And again, we're now vaccinating full speed ahead. We're at over 113,000, and I will talk a lot about vaccinations because we've had a lot of questions and so on. So again, great work that our community has done to really bring the numbers down. We need to continue so we can very successfully go into step 1, step 2, and don't look back again. So that is the good news. In terms of the vaccines, a couple of things that I really wanted to cover today. Well, first of all, we're at 113,000 over 113,000, and that represents 67%, just a bit more than 67, almost 68% of our 18 and plus population having received one vaccine. And just looking forward to some clinics. I know we've added a few clinics. We are now added more clinics from June 21st on. I know that people are having difficulty getting some appointments, but we did add some more clinics. Between June 1st and June 12th, we have 18,000 fully booked. Of which there are about 3,000 12 to 17-year-olds. We also have clinics, a certain percentage of the clinics on between the week of June 14th and the week of June 21st. That are going to be added, that will be partially reserved for 12 to 17 and their families. In addition, we're also going to be adding 4,400 more vaccines, so another 18,000 vaccines between now and June 21st to be available. Again, I just want to talk about a few things that have happened over the weekend. Number one, we know that the AstraZeneca second dose is now being able to be given. The expiry date on that has been extended to July 1st, and so we don't have it in our area, but for individuals that did receive AstraZeneca first dose from either primary care or from pharmacies in our area, stay tuned. They will be receiving it, and they will reach out to you to be able to get your second dose of AstraZeneca at that point in time. A few other things that are going on as well. We have now been given our Pfizer allocations, which are a bit more than they were in May, but in June. And so we know we have a sight line till the first week of July. So we're able to plan our clinics. We also should be getting increased amount of Moderna this week, which we didn't expect, so that's good. We'll just stay tuned for that. Now, I want to talk about a few things that have happened in terms of second dosages, and there's a couple of things that I just want to clarify to everybody. We've had a lot of emails about that today. Now, the ministry has made appointment for a second dose. It's you want to go in and change your date from your original second date, and if you qualify, for example, people from as of May 31st, as of today, 80 and over can go in to the system, and if they've had a second appointment booked, they can move it up. And then in 2 weeks, June 14th, the same is going to happen to 70-year-olds. However, what's happened is the provincial booking system started around the third week of March. And we know that before that, individuals who received their first dose went through another system, did not go through that, and for the most part, we're not given the second dose appointment. Now, a lot of them have been have got the second dose through retirement homes and so on, and long-term care. But there are several thousands of individuals that we are very aware of, including essential workers, 80 plus as well, that have not yet been able to book a second appointment, and that's a glitch in the system. They were supposed to be able to book a second appointment, but there's an issue with the system, and so we are very well aware of that. So I want to reassure everybody that we know who you are. We have a list of them. We know how many they are. We know when they're due. And we will be reserving spaces and vaccine for those individuals that received their first dose sometime in February, March. Where they will be due, and we know that our first ones are starting to be due around June 20th or so, and at that point we have contingencies, and don't worry, you will get your vaccine in time. So that's for sure. That's going to be a temporary issue, because that's only going to cover those individuals. And again, it's several thousand individuals who received their first vaccine outside of the provincial booking system. Everybody else who received their first dose appointment received a second dose appointment. So that's a different issue. So for the individuals who don't yet have a second dose appointment, please do not worry. We know who you are. We have the numbers. There will be mechanisms. We'll reach out to you if you've registered online, pre-registered, or otherwise you'll get a call from us, and we will select and create special clinics for you. Do not worry. We do have the vaccine. We will reserve the vaccine, and we will reserve the spaces in time for your second doses. Now, for everyone else, it's very important, again, as we then, for everybody else who was on the system, when they got their first appointment, they got their second appointment 4 months apart. As we trigger earlier second doses, and we do that by age range, those individuals will have a chance to go on and move their appointment up earlier, and we will be adding clinics. Like I said, we anticipate, again, at the rate that we're going right now, literally by the June 5th, we will be at 73% of first doses in our area, and by a week after that, we will be over 78%. So you can see at that point in time, having saturated, we'd like to go a bit more, 80-85% of the population, but at that point you will see there will be right now most of our clinics are first dose. There will be a switch over, sort of an overlap where again, clinics moving forward, likely the second, third week of June, will be mostly devoted to second doses. And so and we do have vaccine coming in, we know that, and so we anticipate that all the vaccines that we'll be getting, and again, we were given an approximation between now and July. We'll be getting, like I said, from as of last week until July, we will be getting close to 63,000 doses, so, just at that time. So we have a lot of vaccine. So, and again, there's less than 63,000 people needing first dose. So those will be second dose, and they will be progressed. And so over the summer, as we go into age groups, as we go into lower age groups, being available, and then we'll come to a point where we'll have vaccine, and for example, people receiving the first dose will get their second dose, very close to the 3 or 4 week period, depending on what vaccine they use. So I just want to reassure everybody, I've personally received multiple emails. We're getting a lot of calls, and again, it's the system is not allowing it to do it provincially. And and I know that, and they send them to us, and people are quite worried. But please do not worry. We do know who you are. We have the numbers reserved for you. We know when the dates are, and we are really working to ensure that you get your second dose. And again, please don't worry. Again, I wanted to stress that because it's quite important for that. And one more thing, I just wanted to highlight as well, is that school, we're not sure what's going to go on with schools. As you know, there might be an announcement this week. And so if there is an announcement, it likely will be next Monday to schools reopening, but that we're not sure at this point. We submitted collectively the medical officers of health, along with the pediatric hospitals, the science table, Ontario Medical Association, a joint letter, asking and giving reasons for the schools to reopen. But at this point, we don't have any indication yet of when there'll be an announcement, but I do suspect it'll be forthcoming. Bonjour tout le monde. Je vais commencer avec le chiffre ontarienne. Pour la première fois dans quelques mois, je pense, on a eu moins de 1000 cas, 916 cas depuis le jour précédent. Toujours Toronto et leur entour mènent, mais on voit que là aussi, on voit les chiffres qui sont diminués. Par exemple, aujourd'hui, on a eu 226 cas à Toronto. Il y a quelques semaines qu'on avait presque 900, 950 par jour. Donc, ça va dans la bonne direction. Et aussi, on peut voir aussi sur nos statistiques locales, ça va bien aussi. En effet, juste aujourd'hui, on n'a aucun cas de rapporté, mais pendant la fin de semaine, on voit que nous avons ajouté 7 cas. Je pense 3 jours, 3 samedi, 4 dimanche ou quelque chose comme ça, mais vous pouvez voir 7 jours pendant la fin de semaine, c'est très bon pour nous. J'aurais mieux avoir 0, 0, 0, mais c'est beaucoup mieux que c'était avant. Vous allez noter ici qu'au niveau de la moyenne mobile, on voit clairement qu'on est rendu vraiment en bas de zone orange, dans zone jaune, qui est très bonne. Donc, on devrait continuer avec les précautions de santé publique. On ne sait pas si et quand le gouvernement va enlever en effet l'échéance de la courante déclaration d'urgence avec l'ordonnance de rester chez vous va expirer le 2 juin, donc dans 2 jours. Donc, on attend une décision du gouvernement d'Ontario de qu'est-ce que ça va arriver après le 2 et qu'est-ce qu'on va faire entre le 2 et à peu près le 14 juin, où on est sensible de rentrer dans étape 1 si tout va bien. Il faut noter que malgré qu'au niveau de la province, on voit que les cas diminuent, les admissions à soins intensifs sont encore élevées, ils sont à 617, mais c'est diminuant, mais ça va très tranquillement, doucement. Par contre, les admissions totales sont à peu près à 731, qui est beaucoup moins qu'il y a à peu près un mois, on était rendu à 1900, je pense. Donc, on voit dans la bonne direction. Nous aussi, on n'a aucune flambée actuellement dans notre région. Et on voit ici qu'on a 7 hospitalisés et 3 soins intensifs, mais ce n'est pas augmenté beaucoup. Donc, c'est stable dans ce sens-là. Il faut toujours maintenir les précautions de santé publique. On voit ici maintenant que nous avons vacciné plus que 113 000 personnes dans notre région, qui est de très bonnes nouvelles. Donc, avec ces chiffres, sans de compter les chiffres d'aujourd'hui, on est rendu à plus que 113, qui représente à peu près 67 à 68 de la population adulte dans notre région. On va continuer la semaine prochaine, on va vacciner une autre 9 000, donc ça va nous rendre à 73 de la population. Et le 12 juin, on va avoir vacciné plus que 130 000. À ce moment-là, ça approche le 80%. Donc, ça va très bien dans notre région. Nous avons ajouté des cliniques. Nous avons ajouté des cliniques. On a 18 000 déjà, presque toutes bookées jusqu'au 12 juin, qui comprend 3 000 des 12 à 17 ans des adolescents. On a ajouté une autre 12 000 les semaines en effet, un autre 16 000 entre le 14 et le 20, ces 2 semaines-là, le 14 et le 21, à ce moment-là. Donc, on a réservé aussi des places pour les personnes 12 à 17 ans, mais aussi on a des places réservées pour d'autres personnes. Donc, ceci va bien. Je vais juste parler un peu des deuxièmes doses. On a eu beaucoup de questions aujourd'hui, des appels et des courriers électroniques de personnes qui avaient reçu leur vaccin avant que le système provincial avait été mis en ligne à peu près le 20 mars. Donc, les personnes avant, ils sont quelques mille dans notre région qui ont reçu leur première dose, mais ils n'avaient pas reçu un rendez-vous pour le deuxième rendez-vous. Donc, ça, c'est un problème. Le ministère était sensible d'avoir la capacité de booker votre rendez-vous, mais apparemment, ils ont des problèmes techniques qui vont être réglés. Mais entre-temps, je vais rassurer tout le monde qu'on sait exactement qui est dû. On sait que les premières, deuxièmes doses sont dues, qui étaient données à peu près au mois de février-mars. Ils commencent à être dus à peu près le 21 juin. Donc, à ce moment-là, nous savons qui est dû, nous savons combien de personnes sont dues et nous allons les contacter, soit par téléphone, soit par courrier électronique, pour leur donner un deuxième rendez-vous jusqu'à temps que le problème est là avec le système provincial. Ça, c'est différent parce que là, je parle des personnes qui ont eu leur vaccin sans avoir un rendez-vous de système provincial. Okay? Donc, à ce moment-là, dès à peu près le 20 mars, quand le système provincial a commencé, toutes les personnes qui ont booké, à ce moment-là, ils ont reçu leur rendez-vous pour la deuxième dose au même temps. Donc, c'était à peu près 4 mois d'avancée. Ces personnes, une fois qu'on peut reculer, un peu avancer, si vous voulez, leur rendez-vous, parce que pour les personnes 80 ans et plus, on voit, on peut, dès aujourd'hui, si, disons, on avait un rendez-vous au mois de juin, on pourrait l'avancer, au fin juin, mi-juillet, on pourrait l'avancer maintenant. Et la même chose va arriver dans 2 semaines avec les personnes 70 ans et plus. Donc, à ce moment-là, aujourd'hui, je sais que c'était difficile pour les personnes d'aller chercher pour l'avancer, mais inquiétez-vous pas, on a ajouté des cliniques aussi. D'ici quelques jours, vous allez être capable de booker votre rendez-vous. Mais j'aimerais revenir au premier problème. Aux personnes, donc on parle des personnes qui ont déjà eu le rendez-vous, le deuxième rendez-vous de booker, dès aujourd'hui ou dans quelques jours, parce qu'on a ajouté d'autres cliniques, parce que les cliniques jusqu'au 12 juillet sont bookées. Donc, dès aujourd'hui, par contre, dans les quelques jours, vous pouvez appeler et si vous avez 80 et plus, vous pouvez avancer votre rendez-vous. Là, je parle des personnes qui n'ont pas eu leur deuxième rendez-vous à cause qu'ils ont reçu le vaccin avant que le système provincial était en ligne. Donc, pour ces personnes, inquiétez-vous pas, nous avons vos coordonnées, nous savons combien vous êtes. Nous allons réserver vos places et nous allons réserver aussi les vaccins pour vous. Donc, inquiétez-vous pas, on est sensible de recevoir 65 000 doses de vaccins d'ici la première semaine de juillet. Donc, on aurait assez de vaccins et inquiétez-vous pas, mais je parle ce tranche des personnes qui exclusivement ont reçu leur vaccin sans l'avoir booké sur leur système provincial. Mais à un moment donné, toutes les personnes après le 20 mars à peu près ça, il n'y aura pas de problème. Donc, les personnes qui n'ont pas un rendez-vous, inquiétez-vous pas, on va vous contacter et à un moment donné, vous allez être capable de le faire par le système provincial qui n'est pas encore capable de le faire avec des troubles techniques. Donc, inquiétez-vous pas. Je veux juste parler avant que je finisse des écoles. Les écoles sont encore fermées. Comme vous savez, on est sensible d'avoir une décision du gouvernement, soit aujourd'hui ou demain. Les experts en santé publique, le TAB de conseil de sciences, l'association médicale, les hôpitaux pédiatriques, on a tous signé une lettre conjointe qui a suggéré que ça serait le bon temps de commencer les écoles. Donc, on ne sait pas qu'est-ce que le gouvernement va faire. So I'm going to go to the questions here, and most of the questions I've actually answered. La plupart des questions ici, je les ai répondues parce que because they were asking about the second booking. And again, the specific question is, are vaccine booking dates beyond mid-June now in the provincial system? Yes, as of today, into the 21st are in. They should be available to people over the next couple of days to be able to book them. Just getting total numbers. Total numbers have been low in terms of leader assessment, number of assessment centers. Yeah, talking about testing centers and assessment centers, yes, the numbers are low. And so we're working with the hospitals to kind of have a flexible approach. When we see the demand increasing, we will increase the testing center capacity and then vice versa as well. For those eligible to move up the date of the second vaccine, who received the vaccine through hospital, clinic, pharmacy, primary care provider, how should they be scheduling? Yes, and this is exactly what I'm talking about. Either your primary care provider will reach you, the pharmacy will reach you, and if you receive it through us, we will be reaching you, and there will be a mechanism for that. And again, we will do that internally with our system, but eventually there will be a provincial system that will be available for that. Yes, and again, this is, again, another question about the second dose. Again, don't worry. I know it's one Bill asks about a July 9th. Again, we will be for sure having people contact everybody. There will be a contact, and we do have vaccine and places for that. And then another question that I got from another media was about the same. And I know people are frustrated, but again, do not worry. We thought that the people could then book on the second dose, the second doses if they're eligible. But again, we will be doing that internally just until the glitch is finished. Jenna, that's all for these. Let's take some questions, please.
Thank you, Dr. Paul. Merci. Our first question comes from Bill Kingston, Cornwall Newswatch. Please go ahead.
Yes, hi, Dr. Paul. Just to follow up on my question I gave to you. So you say that you have several thousand of these people that fall into this second dose. You've made I think you said 18,000 appointments between now and June 21st. How do you appease those people that feel like they're falling through the cracks? Because I mean, 80 plus this week, 70 plus in 2 weeks. People feel like they went early and that other people are stepping ahead of them right now.
Not at all. The people that are stepping ahead of them are first doses. Our first dose. So nobody is stepping ahead of them for second dose. We are well aware of when they can get their second dose, and so and some Bill don't fall into the category of receiving the second dose. They're less than 70. Okay, let's put it this way. Even them, we have to respect the dates. We have the dates here. So what we're saying is we know the dates. For example, I know that people that received their their dose on March 10th, they need to get it June 30th. Like, we know who they are. And so I just wanted to ensure if they are able to do it earlier, that they will be able to book it earlier through the system. But at this point, we're not going to, let's say it's a 50-year-old or somebody who got it for other reasons. In those points, we do have a list of when they had it and when they're due, and we're reserving second doses exclusively for them. So I don't want people to worry.
Okay. So how do you ensure that there is that your allotment, you talked about that you might have to set up special clinics for these. How do you ensure that you have enough doses to be able to
we are reserving them. We are reserving them through the system. We know how many we have, and we are saying, okay, at this point we need just give an example. Let's say in a clinic we have 1,000 people. We need 500 doses for a second dose. We'll reserve those for second dose.
Okay.
The point will be moot at one point, Bill, as we start going over, and then it'll be overwhelmingly second doses anyway. I anticipate if you look at our numbers, Bill, I'm anticipating that we'll be at, we'll have saturated kind of first dose urgent sort of needs by probably the week of June 6th to 12th. Where we'll be probably at around 78-80% of the population having first dose. So you can imagine with the amount of, and we'll still be receiving the same amount of vaccines we're getting now. You can imagine that then those first doses were already been given, and most of those doses will then be for second dose. So as we progress into the summer, there'll essentially be second dose clinics.
Okay.
It's just a bit of a growing pain right now because we had different systems.
Right. Okay. And my follow-up is your thoughts on Eastern Ontario Health Unit, or being Eastern Ontario. Dr. Kieran Moore will most likely be the Chief Medical Officer of Health. Have you worked with him? What are your thoughts?
Oh, good friend, good guy. I can't say, I'm telling you, Kieran is a excellent medical officer of health. He'll make an excellent chief medical officer of health. Very importantly, I think we have an Eastern bloc, so we always work together. So we have all the way to Belleville. So we've had regular contact. I know his experience. I know his passion for public health. I also know he's a very sensible, communicative individual. So I also, and finally, I also, one of the things that we were worried about moving forward was what's going to happen to public health, modernization and so on. And Kieran and I have talked about it. We understand the importance of local public health. He knows the public health system. So I was hoping that it would be a local medical officer of health that knows public health, because now it's a time of crisis, and we didn't want to, so it's good that we get somebody from Ontario Public Health System, and somebody that knows the nuances of the real sort of local public health system. And so I think it was an excellent choice.
Excellent. Thank you very much.
No problem.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul.
Good afternoon.
So my first question is really a follow-up to ones I asked last week. The stay-at-home order ends on June 2nd. We returned to emergency bake restrictions, but those restrictions have not been altered yet. So it still says that essential retail can open at 50% capacity and non-essential retail at 25%. But the step one reopening is non-essential retail at 15% on June 14th, tentatively. So like we're 2 days away. Is there anything you can tell like retail operators in that?
No, all I can tell you is that we're waiting for the regulations. I spoke to the individuals that are involved in the regulations on Friday, and we're hoping to get some clarity on that. And hopefully there's going to be some clarification when they make an announcement, because there's several things they need to announce, Philip. They need to announce, number one, like what are they going to do? Are they going to extend it? Are they going to, what's going to be that period between, the June 2nd deadline type of thing and that tentative 14th of June? What are you going to do in between? So I suspect that all those are being written as regulations right now, and we'll have more clarity on those.
Okay. And second question is vaccines. Now there's 28,000 appointments for June, and you said you just added more into the system. That was more of that 28,000. Like you didn't book them all at once; you put them in groups.
No, we had 18,000 booked between now and June 12th.
Okay.
And then we added another 16,000 from June 14th on till the end of the 21st, worth of the 21st. So we had another 16,000. Let's put it this way.
That does not include the school/family clinics for 12 to 17-year-olds. It
does. It includes about initially we have booked already before those clinics 3,000 12 to 17-year-olds for our clinics through to June 12th. And then we have reserved another 9,500, around 10,000 spots in our June 14th and June 21st clinics, like that, those weeks.
Okay, and how do families access that? Is that going to be an announcement through the schools?
No,
Or
yes.
Okay.
Letters have gone to the schools, and they can call, they can book online with their kids' OHIP, and then it'll give them access to those clinics where they can also, as parents, get an appointment as a group appointment as well.
Okay.
So letters, we actually sent off initial letters to the parents last week, and actually the new ones are going out today to give them an update.
Okay, and lastly, the education announcement is pending sometime soon, maybe today, tomorrow, whenever. But the Premier sent out questions last week to the health units asking for guidance that had already been given, but asked for it again. But one of the questions in there was about the strains. What's the percentage of the strains of COVID-19 currently in the EOHU, and what do you think about you feel about the threat of the Indian variant, the one that they're now touting?
Yeah. Well, looking at our strains are less than 30% of all cases in our area, so they're going down. They used to be at 70-75%. So most of our, it's fair to say that most of our positives are not the strain. We have not, to my knowledge, had any of the B167, which is the Indian variant. And speaking to Public Health Ontario last week, we had a presentation. It seems that a couple of percentage of all positive cases are the 167, very low percentage, because there's no test for them. So what they do is, if they rule out the other mutations, and if they found any mutations, they presume that's B1067. The science table has a nice graph that shows that there might be perhaps a slight increase in the 167 if schools open, not because the schools are going to cause it, it's because it's going to cause more mobility and secondary transmission that way. But we also believe that, and they also showed that there's not going to be an impact on hospitalizations or ICU admissions. So at this point, if we continue with our measures, I'm not going to be too worried about it. One of the things, however, that we do want to do is we want to be able to get second doses in to people as soon as possible, regardless of schools, because we do know that the one shot partially protects against this Indian variant, whereas the two, gives you much better protection. So there are multitude of reasons that we want to expedite the second doses, and I'm hoping that we can get them done between now and in the end of August.
Okay, thank you.
No problem.
These next two questions from Todd Hamilton, standard freeholder, are deferred from May 27th. Testing numbers have been low in the past weeks. Would or could these lead to a reassessment of the numbers of assessment centers and or their hours of operation?
Yes, I answered that before, Jenna. I said yes, that we're going to be reevaluated, and we're going to have like a sort of a sliding scale. If our hospitals are now able to decrease the the number of hours and so on, and sort of back and forth accordion according to the numbers. Yes.
Great, thank you. Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul.
Hi, Natasha.
I was just wondering, did you by any chance put your hat into the ring for Chief Medical Officer?
No, I did not.
I see. Okay, thank you so much.
Next question, Ryan Jones, CBC Ottawa. Please go ahead.
Hi, thanks very much for taking our question. I just have just looking for some more clarification about the issues with the provincial booking system today as it relates to the over 80 age group becoming eligible for second dose appointments. We saw in Ottawa that they paused all their vaccine appointments across the board because of issues with the provincial booking system, but you've identified issues only affecting those who had their first shot before the system was up and running in the third week of March, as you said. So can you just clarify, like, were people over the age of 80 in the Eastern Ontario Health Unit able to successfully book second dose appointments today if it was after that threshold?
There were a limited amount of 80 plus available to us, to the public, and they were booked. As of over the next couple of days, we do believe that we've added more clinics. And so we had two problems. People couldn't book, but some people were told that there were no appointments. So there were two issues, both of which I think will be rectified shortly. So in summary, one was that we didn't have availability. They got booked pretty quickly. And the other one was that people couldn't even get on to book. So two issues.
And so, yeah, can you just clarify then? Oh no, I've just totally lost it. I think that's good. Thanks.
Okay.
Or sorry, do you know if there's any connection to the like the issues that Ottawa was having? Do you know if those are connected specifically to that the inability of people who had their first dose to?
I don't know.
Sorry.
Look,
Okay.
I know that there's an issue with people who what our major issue is today is people who had their first dose that had it booked through our own internal system before the provincial system came out. And so they did not receive by default a second appointment. And so moving the individuals that received their vaccine after March 22nd, I think it was, who got their appointment after March 22nd, automatically got a second dose appointment 4 months later. Now that could be changed depending on ages, as we move forward. But we're talking about the individuals that started around January, February, mostly February, March, that got their clinics, got their appointments through our internal processes, and were not given a second dose appointment, and that's who we're talking about in my area.
Got it. Thanks a lot.
Okay.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you very much.